It should be taken the same time every day with no breaks. If there's a missed pill, it's considered missed if it's more than 3 hours delay. If missed, use a backup contraceptive for at least 48 hours and continue to take the pills as prescribed. This table shows the indication, mode of action, safe side effects, and contraindications to the use of. This table is about the progestin-only mini pill. So the indication is mostly for women with contraindications to oral contraceptive with estrogen. For example, women who have a thromboembolism risk, women with cardiovascular disease risk, women with postpartum lactated time period. So, but this does not affect the breast milk supply, and persons who have migraines. The mode of action of the progestin-only contraceptive pill is that it thickens the cervical mucus and hence decreases sperm permeability. It only prevents ovulation in 40% of women. The progestin prevents the LH surge. The endometrial decidualization becomes unreceptive for implantation, and it decreases tubal motility. Note briefly, oral progestins are given not intramuscularly, and it does not consistently suppress ovulation compared to the combined oral contraceptive, which actually suppresses ovulation. The side effects of progestin-only contraception is that it gives irregular bleeding, it causes weight gain, it gives headaches, nausea, and persistent ovarian follicle, that is, follicular cyst. It can also cause acne or oily skin, and it can also cause hirsutism with the more androgenic preparations. Contraindications. There are no absolute contraindications to the progestin only contraception, but relative contraindications include previous ectopic pregnancy, current functional ovarian cyst, severe liver disease, severe arterial disease, and breast cancer. Combined oral contraceptive pills. The Pearl index with perfect use is 0.1, but in practice it's 6 to 8. General info. It contains low-dose synthetic estrogen, usually ethinyl estradiol, and progestin, which is a synthetic progestogen. Progestogens may be first generation norethindrone, second generation levonorgestrel, and third generation gestodine norgestimate or desogestrel, which is a which third generation have favorable lipid profile but increased risk of venous thromboembolisms compared to first and second generations. Some also contain two additional compounds, that is, cyproterone acetate for its anti-androgenic effects, for example, diane 35, and 2 drospirone, a spironolactone analog, which reduces excessive fluid and bloating. It's usually taken for 21 days with 7 days off or 7 days of an inert tablet of inert tablets. It may be low dose or ultra low dose. The mode of action. It's actually very similar to progestin-only mode of action, except that the suppression of ovulation is the main mode of action. The main mode of action is to inhibit follicular development and ovulation by inhibiting FSH and LH. Endometrial decidualization happens where it becomes unreceptive for implantation. There is thickening of the cervical mucus and hence a decrease in sperm permeability. There may also be a decrease in tubal motility. If there's a missed pill that is less than 12 hours late, take the pill still and you'll still have the same efficacy. If it's more than 12 hours late, take the pill still and use another contraceptive method for 7 days. If less than 7 pills are left in the packet, start the next packet without a pill-free week between them. Return to normal fertility. Most in 3 months after discontinuation. If not, then usually a different underlying cause is the cause of infertility. For example, PCOS. Cancer and the pill. It actually protects against endometrial and ovarian cancer and benign breast disease. There's an increased risk of breast and cervical cancer and benign hepatic adenoma. This table shows the advantages/health benefits, side effects, absolute contraindications, and relative contraindications to the combined oral contraceptive pill. The advantages include it's highly effective, reversible, cycles are more regular and predictable, it decreases dysmenorrhea, it decreases menorrhagia, decreases anemia, decreases premenstrual syndrome, it decreases benign breast disease development, it decreases the functional ovarian cyst development and also treats them, it decreases endometrial cancer risk, it decreases ovarian cancer risk, it decreases pelvic inflammatory disease due to increased cervical mucus, it causes decreased endometriosis and decreased fibroids. The side effects of the combined oral contraceptive are split into estrogen related and progestin related. The estrogen related include the risk of thromboembolic events, nausea, migraine and headaches, fluid retention and bloating, hepatic adenoma, which is rare, and breakthrough bleeding, as well as breast tenderness and weight gain, which is also rare. Progestin-related side effects include depression, amenorrhea, breakthrough bleeding, breast tenderness, decreased libido, acne, and hirsutism. Absolute contraindications to the combined oral contraceptive include if the patient has known or suspected pregnancy, patient has undiagnosed abnormal PV bleed, personal history of thromboembolic events, personal history of thromboembolic disorders such as factor V Leiden, protein C, protein S or antithrombin 3 deficiency, ischemic heart disease or coronary artery disease, previous cardiovascular accident, cerebrovascular accidents, uncontrolled hypertension, focal or crescendo migraine, and estrogen dependent tumors such as breast or uterine cancer, or if the patient has liver disease or liver tumors, Clarify if the patient is smoking more than 35 pack years is an absolute or relative contraindication to combined oral contraception. Relative contraindications given from RUP include obesity, diabetes, however, the patient can use low dose COCPs if they have diabetes, and hyperprolactinemia. From Toronto Notes, relative contraindications include controlled hypertension, SLE, and sickle cell disease. You must know about UZIP method for using oral contraceptives as an emergency contraception and know about counseling for all contraceptives, especially oral contraception and IUCDs. The injectable contraceptives. You have IM, they're given intramuscularly, similar to their oral counterparts in many ways. The first one we're going to talk about is the depot progestogen, which, for example, you have Depo-Provera, which has 150 milligrams of medroxyprogesterone acetate (MPA). It's given every 3 months. The mode of action is that it interferes with ovulation, thickens the cervical mucus, and 80% of women have scanty menses or amenorrhea after 1 year. Missed, if it's missed for more than 14 weeks, do a beta HCG, then give the next dose. If there's no evidence of fetal abnormalities, risk. Okay, so the non-contraceptive health benefits of the injectable depo-progestogen is that there's a reduced risk of endometrial cancer, ectopic pregnancy, vaginal yeast infection, and acute PID because of the thickness of the cervical mucus. There is also a reduced frequency of severity of sickle cell disease and painful crises. There is a reduced frequency of epileptic seizures and reduced symptoms of endometriosis. The disadvantages include the effects cannot be stopped immediately, and there's a delay in return to fertility. The side effects are common, especially abnormal bleeding. These are the same side effects as the mini pill, and there is no STI or HIV protection. The depot estrogen slash progestogen IM contraception. For example, Mesigina contains 50 milligrams of norethistérone enanthate and 5 milligrams of estradiol valerate is given every month. Others, such as the implants, the Norplant, for, for example, has 36 milligrams of levonorgestrel. The subdermal implant is placed, it is a subdermal implant placed under your arm. I've seen it done, no, implant in the upper arm. Okay, because I know it's done in the medial aspect of the upper arm and lasts at least 5 years. The transdermal hormonal patches, such as the Arthur Evra, is a weekly contraceptive patch. Advantage is that there is no need to remember pills, and the contraceptive ring, such as the Nova ring, contains combined estrogen and progesterone, and it's just as effective as the oral contraceptive in preventing pregnancy